Thank you, Mr. Chair. This amendment would prevent the Substance Abuse and Mental Health Services Administration from implementing further harmful and irresponsible mass layoffs. And rather than being political theater, this is an effort to keep the very constituents, friends, and family who perform the important work that keep our constituents, friends, and family safe and healthy. SAMHSA leads efforts to address our nation's mental health crises, including focused initiatives to reduce the rates of suicide and drug overdose. But on March 7th, Secretary Kennedy announced that SAMHSA would essentially cease to exist as employees are fired or absorbed into a consolidated and smaller office. And without an agency dedicated to behavioral health addressing suicide, overdose, and youth mental health, they're less likely to be prioritized. On April 1st, Secretary Kennedy fired nearly half of SAMHSA's remaining staff, including its director for the Center for Mental Health Services. Secretary Kennedy also fired the entire Office of Population Surveys. This is the team that oversees the National Survey on Drug Use and Health, our only national survey focused specifically on drug use and mental health. Now, I don't know who, if anybody, will take on these crucial tasks of tracking drug use and mental health across the country. In recent years, we've made progress in reducing overdose deaths, in large part due to SAMHSA's programs addressing substance use. But overdose deaths remain the leading cause of death for younger adults, underscoring the need to ensure that this progress continues. And I remind you, overdose deaths are one of the leading causes of death for pregnancy-related deaths, including the #1 cause of death for white women. The reckless firing of SAMHSA staff without cause deals a devastating blow to our efforts to prevent overdose deaths and related maternal deaths. SAMHSA also administers grants that support the 988 National Suicide Prevention Lifeline. In its first year, 988 received 4 million calls, a 33% increase in people reaching out for help. But in February, a quarter of the 988 Lifeline team at SAMHSA was fired, and these critical mental health programs are not effective without a workforce to implement them. SAMHSA's Pregnant and Postpartum Women's Substance Use Disorder Treatment Program, which funds parent-child residential treatment and critical workforce training programs, will be nearly eliminated, with approximately 92% in cuts. In Virginia, SAMHSA grants fund programs like tackling substance use, mental illness, grief, trauma, and challenges faced by individuals with mental health or substance use concerns, many of whom lack stable housing. The Henrico Area Mental Health and Development Services receive SAMHSA funding for their programs, which serve constituents in my district, including supportive permanent housing programs for pregnant and parenting women. And a participant shared in the local press that this program helped her maintain sobriety and secure stable housing, which allowed her to be reunited with her child. And as we've stated, these attacks on SAMHSA are not happening in isolation, but combined with the proposed drastic cuts to Medicaid mandated by a plan that tells this committee to find $880 billion in cuts, would devastate Virginians and Americans receiving treatment for substance use disorders, particularly in rural areas, whose access to substance use disorder treatment through community health centers depend on Medicaid to stay open. So when you combine these workforce cuts to funding freezes to Medicaid cuts, we are going to have a very difficult time actually addressing the opioid and substance use disorder crisis in this country and the related crises like maternal mortality. So I urge support for this amendment to prevent the further gutting of SAMHSA at this critical time. Thank you, and I yield back.